There's acute sinusitis, which is primarily an infective thing, and then there's people who suffer from chronic sinus inflammation. Acute sinusitis is mainly an infective phenomenon. Patients will often have pain and pressure on their face on one side only. Often that pain radiates down to the teeth or into the back of the eye, and they'll be very blocked and congested on one side, and sometimes even have a bad smell in their nose. If that's an acute event and it's only on one side, then that is very suggestive that someone's got a bacterial cause. And chronic sinus disease is not an infective phenomenon for most people. It's an inflammatory disorder, a little bit like asthma and other airway disorders. Most people, when they get symptoms, they are bilateral and they're really part of a rhinitis reaction. A rhinitis reaction means you've just got an inflammation of your nasal passage. They can get very blocked, very congested. They can often feel tissues and tissues worth of mucus and secretion. And if you do a scan of someone during that acute rhinitis event, they often have completely normal sinuses. Rhinitis is thought to affect 20 to 30% of the Australian community, with about a couple of million presenting with sort of active symptoms all the time. When patients have lingering mucus and other symptoms, we get them on really simple treatments like nasal saline irrigations, where they're using a saline irrigation to wash out the mucus production from their nose. This often makes people feel like they're clearer, they're easy to breathe, and helps to, help them recover from their symptoms a bit quicker. Nasal irrigation has been around for many centuries in different cultures and societies around the world. Some people really become converts of nasal irrigation. They've gone away from perhaps erroneously relying on antibiotics to manage mucus symptoms that come about during winter to really just managing them with nasal irrigation.